CCMA NHA Exam Review. Question 1. A patient requests that their appointment reminder be sent to a different email than the one on file. What should the CMAA do first? Send the reminder immediately. Update the email without confirmation. Verify patient identity and document the change. Refuse the request. Any change involving patient contact information linked to PHI requires identity verification to prevent unauthorized access. Update the record only after confirming the patient's identity using 2 identifiers and document the change properly. Question 2. Which situation best demonstrates compliance with the minimum necessary rule? Allowing all staff access to full records. Sharing only required billing details with insurance. Giving full charts to front desk staff. Discussing diagnosis during check-in. Sharing only the billing details needed for claim submission, not entire records, follows the minimum necessary principle. Staff should access only the PHI required to perform their specific job duties, not entire records unless necessary. Question 3. A CMA overhears a coworker accessing a patient record without a job-related reason. What is the most appropriate action? Ignore the situation. Confront the coworker publicly. Report according to office policy. Warn the patient. Unauthorized access to patient records is a serious HIPAA violation. The CMA should report the incident according to office policy, typically to a supervisor or compliance officer, rather than confronting the coworker directly or ignoring the behavior. Question 4. Why is it inappropriate for a CMA to explain a diagnosis to a patient? It exceeds administrative scope of practice. It delays care. Patients dislike explanations. Insurance does not allow it. Explaining diagnoses requires clinical training and licensure. This task exceeds the CMA's administrative scope of practice and must be performed by the provider. CMAs should refer clinical questions to licensed medical staff. Question 5. A patient signs in using their full name and reason for visit on a visible sheet. What is the best correction? Leave it unchanged. Cover the sheet. Use initials or a number system. Remove sign-in sheets completely. Sign-in sheets should avoid displaying PHI such as full names linked to medical reasons. Using initials, patient numbers, or separate name and reason columns protects patient privacy while still allowing check-in tracking. Question 6. Which action best supports accurate insurance billing? Relying on patient memory, verifying coverage each visit, skipping eligibility checks, collecting payment later. Insurance coverage, benefits, and patient responsibility can change frequently due to employment changes, plan updates, or deductible resets. Verifying eligibility before each visit prevents denials, reduces billing disputes, and ensures accurate collection of copays and deductibles. Question 7. A patient becomes confused about a bill. What is the most appropriate CMA response? Tell them to contact insurance only. Dismiss the concern. Clearly explain charges and next steps. Cancel the balance. Professional communication includes explaining charges clearly, reviewing the statement line by line, and offering to assist with contacting insurance or setting up a payment plan if needed. Canceling charges or dismissing concerns is inappropriate and may violate compliance standards. Question 8. Which action could be considered falsification of records? Correcting an error with documentation, backdating an entry to appear timely, updating contact information, adding missing insurance details. Backdating entries misrepresents when information was recorded and is legally and ethically prohibited. Corrections should be made with a single line through the error, notation of correction, initials, and the current date, never backdated. Question 9. Why should CMAs avoid using personal devices for work communication? Slower performance, office preference, risk of PHI exposure, battery issues. Personal devices may lack encryption, secure access controls, and proper data security measures required by HIPAA. Using them for work communication increases the risk of unauthorized PHI exposure, data breaches, and non-compliance with privacy regulations. Question 10. What is the primary reason for confirming patient identity using two identifiers? Patient safety and accuracy, office appearance, speed, legal requirement only. Two identifier verification, e.g., name and date of birth, reduces the risk of wrong patient errors that can lead to serious harm, incorrect treatment, misdiagnosis, or billing mistakes. This is both a patient safety measure and a legal requirement under HIPAA. Question 11. Which situation most likely requires a written incident report? Potential PHI breach, computer running slow, late appointment, phone call inquiry. Incidents involving privacy, safety, or security concerns such as potential PHI breaches, needle stick injuries, or patient falls require formal written incident reports. These document the event for risk management, compliance, and legal protection. Question 12. A patient requests copies of records immediately. Under HIPAA, the office has up to how long to respond? 7 days, 14 days, 30 days, 60 days. HIPAA allows covered entities up to 30 days to fulfill medical record requests, with one possible 30-day extension if documented and communicated to the patient. Immediate response is not required, but timely processing is expected. Question 13. What is the main risk of discussing patients on social media even without names? Poor reputation, HIPAA violations due to indirect identification, loss of followers, office discipline only. Even without using names, details such as age, condition, date of visit, or other unique identifiers may indirectly identify a patient. Such posts can constitute HIPAA violations, leading to fines, termination, and legal consequences. Question 14. A CMA receives a subpoena for patient records. What should they do first? Release records immediately. Ignore the request. Notify supervisor or compliance officer. Call the patient. Legal requests such as subpoenas must be reviewed by authorized personnel, supervisor, compliance officer, or legal counsel before any records are released. Releasing records without proper review may violate patient privacy laws and HIPAA. Question 15. Which behavior best reflects patient-centered care? Prioritizing office speed, respecting patient preferences, following provider schedule only, minimizing communication. Patient-centered care focuses on respecting individual patient preferences, needs, and values. This includes involving patients in decisions, accommodating reasonable requests, and ensuring all care decisions respect patient autonomy and dignity. Question 16. Why should sensitive documents never be left unattended? Office appearance, risk of misfiling, unauthorized access to PHI, fire hazard. Unattended documents containing PHI may be viewed, copied, or removed by unauthorized individuals, leading to data breaches and HIPAA violations. Documents should be secured in locked cabinets or desks when not in use, and workstations should be cleared before leaving. Question 17. What is the CMA's responsibility regarding advance directives? Ensure they are documented in the record, provide legal advice, interpret them, enforce decisions. CMAs help ensure that advance directives, living wills, Healthcare proxies are properly scanned, documented, and easily accessible in the patient record. They do not provide legal advice, interpret legal documents, or enforce medical decisions, which are provider and legal responsibilities. Question 18. Which practice best supports professionalism? Casual language, ignoring complaints, respectful communication, informal attire. Respectful, clear, and empathetic communication with patients, families, and colleagues is a cornerstone of professionalism. It builds trust, reduces conflict, and reflects ethical standards regardless of dress code or formality level. Question 19. A patient requests information not covered by the ROI. What should the CCMA do? Release anyway. Refuse and document. Ask patient verbally. Share partially. Only information specifically authorized by the signed release of information form may be disclosed. Requests for information outside the ROI scope must be refused, and the refusal should be documented. A new ROI may be required. Question 20. Why is documentation timing important? Improves speed, meets insurance deadlines, ensures accuracy and legal validity, reduces training. Timely documentation is more accurate because details are fresh in memory. It also ensures legal validity and compliance with billing deadlines. Delayed documentation increases the risk of errors and may be viewed unfavorably in legal proceedings. Question 21. Which action demonstrates ethical integrity? Ignoring minor violations, reporting concerns appropriately, covering for coworkers, bending rules for patients. Ethical integrity includes accountability and proper reporting of compliance concerns, errors, or violations. Reporting through appropriate channels, not ignoring or covering up, protects patients, maintains standards, and fulfills professional obligations. Question 22. What is the main goal of appointment confirmation systems? Marketing, increase billing, reduce no-shows, improve coding. Appointment confirmation systems: phone, text, email, remind patients of upcoming appointments, significantly reducing no-show rates. This improves access for other patients, optimizes provider schedules, and reduces lost revenue from missed appointments. Question 23. Why should CMAs avoid multitasking during patient interactions? Increases risk of errors and miscommunication. Appears unprofessional. Slows work. Patients dislike it. Divided attention during patient interactions increases the likelihood of errors, such as entering incorrect information, missing important details, or miscommunicating. Focused attention improves accuracy and patient experience, especially when handling PHI or scheduling. Question 24. Which scenario most requires escalation to management? Suspected insurance fraud, scheduling conflict, patient dissatisfaction, long wait time. Suspected insurance fraud carries serious legal consequences, including fines, audits, and potential criminal penalties. Such concerns must be escalated immediately to management or compliance rather than handled by administrative staff alone. Question 25. What best defines the CMA's role in healthcare? Administrative only, financial only, supporting safe, ethical, and efficient patient care, replacing clinical staff. CMAs play a critical support role that directly affects patient safety, regulatory compliance, and care quality. Their administrative functions, scheduling, registration, billing, records management, are essential to efficient healthcare delivery and patient-centered care.